All right, so one of the things I'm going to do in 2025 is be a lot more vocal about my cases and what I'm doing. So right now I have a patient sitting inside who's very scared. So they were scheduled for an extraction. We had to do a surgical extraction of their wisdom tooth, and now they're literally freaking out. So I've given them a alternate treatment plan, and I'm going to show you in just a bit about the kind of tooth they have. They're traveling day after tomorrow, and even though this was scheduled, they traveled from abroad to get this done. But most of our patients will have dental anxiety. And as healthcare providers, it is our responsibility to make sure that our patients have an alternate treatment plan, and at the same time, they're comfortable enough to, comfortable enough to express how they're feeling. Because if a patient is going into a surgery this anxious, and in my career, I've seen that things would always go wrong, and it will be more complicated for them. So, and for us as doctors. So this is what we're going to do. I'm going to show you in just a bit the before and afters. Let's go. So this is their tooth, extreme pericoronitis, lower left wisdom tooth. They had multiple episodes of pericoronitis while they were abroad. This is the panoramic view. You can see it's very close to the inferior alveolar nerve right here. And the beauty of the CBCT, it actually shows you how close you are. So this is where the inferior alveolar nerve is in a very intimate contact. We've got an approximate distance of just less than a millimeter between the distal roots and the inferior alveolar nerve. So this is going to be a complicated extraction. The patient is generally very scared about it, and that's where we come in, and that's where we give an alternate treatment plan. Anesthesia, but no drilling, nothing, just the gum part gets removed. If I've done these 100 cases, 95% of the patients have been very happy, right? And for years they haven't come back. And they're like, yeah, Danya, jaan chhod gaye. I have had no problem. Jab se wo laser ho gaya, I'm at peace, right? 5% of patients do come back saying कि यार फिर भी कभी-कभी दर्द होता है. So let's just get done with the extraction. Let's suppose we don't do the extraction, we do the laser. Your next year, 2 years, and you're like, I'm not coming back to Karachi for another year or 2 years. I'll be like, Hafiz, ye humne kar diya, and hopefully this will carry on for a few years. If it's not bothering you, next time you're here, we can plan it slightly more earlier in your trip rather than right before you travel, right?
Again, we are going to give you a gel that we will apply on your device so that you qualify for inside your mouth. Okay? But this is absolutely.